Toronto, January 18, 1856. My dear Felicity, you must have thought without doubt that I was not going to write to you again, since I have not answered the letters you have written to me. But do not think that. I would have written to you a long time ago had it not been that I was still hoping to have better news for you. Seeing that it is not the case, I am sitting down today to repair my fault in getting in touch with you for a few moments. My eyes have been troubling me since last June, and even now I have to use glasses as I write. After that, God visited us with a typhoid malady. Since October, we have always had 2 or 3 sisters ill, and we have lost 2. Sister Alphonsus, who died in Hamilton, and Sister Ignatius, who died here at the novitiate. She was a novice but an excellent religious. In losing her, we have lost a pillar for the future organization. At present, her sister is dangerously ill with consumption. They received the habit at the same time, the first in our novitiate house, and now they are the first to leave it. Sister Teresa Strakhoff has been ill for more than a month. Consequently, I was obliged to take charge of the orphan asylum. You can conclude that I have plenty to do, with only young sisters around. And in the midst of all this trouble, 2 of the professed sisters left the congregation. Indeed, my dear sister, I could not tell you all the trials of the last year. God has visited me with his whip. May his holy will be done. At present, we have no one dangerously ill except Sister Angela, who has consumption. 2 of our postulants are convalescing after the typhoid fever. One of them received the habit while in bed, receiving this name Sister Euphrasia. Pray, my good sister, that the good Lord will deliver us from this sickness. I have not written to our Reverend Mother Celestine, nor to my brother or sister for nearly a year. You see by that I do not write often. We hope to have a little ceremony on the 29th of this month, if the good God does not afflict us more. 2 or 3 will make their vows, and 1 will take the habit. Ask God to give them constancy, because they have precious little. The least wind at adversity overwhelms them and causes them to fall. I received a letter from dear Sister Philomene a few weeks ago, but I have not answered it either. As for poor Sister Protase, I cannot tell you how long it is since I wrote to her. However, it is not that I have forgotten them, but circumstances do not permit me to write. My dear sister, 20 years ago, yesterday, the feast of Saint Anthony, we embarked at Le Havre de Grâce. Who would have thought that in 20 years we would all be alive and separated from one another by so great a distance? We would not have been capable of believing it. How much we must admire divine providence for protecting us so securely this hour. Think of me sometimes in your prayers. As for me, I do not forget you in mine. I know you always have many children to take care and much to do. If you see Father, give him my humble regards. Love to all our dear sisters. Pray for her with your affectionate sister, Sister Delphine.
Five sisters departing for Prince Arthur's Landing. A sad, sad day. Never before was such a heart-rending scene witnessed in our convent. Mother de Pazzi, Sisters Gertrude, Beatrice, Vincent, and Monica are appointed to found this house. They left Toronto by 11:30 train, expecting to meet the steamer Francis Smith at 4 o'clock in Collingwood, where Bishop Jameau is to meet them and escort them to their destination, a far-away mission, to work at whatever was felt to be necessary in religious, educational, and hospital work. As the Canadian Pacific Railway was being built to Winnipeg, there were many injuries to the railway workers. Local doctors did their best, but there were no hospitals. Port Arthur reached out to the sisters. Mother DePazzi and Sister Monica were taken to an empty building by lantern light to see a poor man who had been brought in from the railway line. Both legs were cut off above the knees, and his feet, still in the boots, were lying in a corner of the room. The sisters took him to their convent and nursed him back to health. After word spread about his recovery, many others came to the convent for care. In early September 1882, the need for a hospital was raised in a meeting with Father Pierre Hamel, rector of St. Andrew's Church. He offered 2 acres of church land and appointed the sisters to take charge of the facility. For almost 40 years, Mother Monica devoted herself to caring for the infirmed and maimed, visiting every patient every day. While the people of Port Arthur were always generous and willing to support the new hospital, the sisters nevertheless went begging up and down the railway line, pumping a handcart, and venturing 17 miles into the lumber camps. They developed a payment system whereby each worker who supported the sisters' ministry received a card which prepaid any care they might need in the future, a sort of prepaid medical plan. The original St. Joseph's Hospital had space for 30 beds. Additions were made in 1900, 1905, 1913, 1928, and 1948. In the 1950s, there was a powerful stigma associated with anyone suffering from alcoholism. A review of hospital records revealed that a large number of patients were repeatedly admitted to the hospital with alcohol-related illnesses. The urgent need for treatment in Thunder Bay was embraced by St. Joseph's Hospital in the mid-1960s by Sister Patricia Margaret Smith, the administrator who was overseeing current demolitions and expansion, which created an opportunity for expanded services to the community. Sister Margaret Smith was given the mandate to initiate a new treatment program, but was advised that OHIP, the Ontario Health Insurance Program, did not cover payment for such programs in a general hospital. So she negotiated with the head of the Ontario Hospital Services Commission until the policy changed. In June 1967, a special medical unit for the treatment of alcohol and other related illnesses opened at St. Joseph's Hospital. Addiction treatment programs were added to the center, and by 1999, programs for youth addiction, eating disorders, and special care for Indigenous patients were also introduced. The legacy of care was continued in 2007 in a new building named the Sister Margaret Smith Center. Today, in 2025, St. Joseph's Care Group embraces the needs of those who are sick and suffering by providing health services beyond Thunder Bay all the way to the northwestern Ontario regions of Kenora and Rainy River. The tiny seed planted in 1882 in St. Joseph's Hospital at Prince Arthur's Landing has grown into a flourishing tree, St. Joseph's Care Group, spreading its branches over almost 13,000 square miles.
Hamilton, celebrating the Sisters' care of orphans. The Sisters of St. Joseph of Hamilton cared for orphans at various locations, including their mother house, since 1852. The most prominent was St. Mary's Orphanage, which opened in 1864 and closed in 1960. To raise funds to support the orphanage, the sisters began doing country collections in 1854 and established the Orphans' Festival in 1853, which continued until 1956. London, celebrating the sisters' work in healthcare at St. Joseph's Hospital, London. St. Joseph's Hospital was founded in London in 1888 after Dr. W.T. O'Reilly, the Inspector of Prisons and Public Charities, encouraged Mother Ignatia Campbell of the Sisters of St. Joseph to start a hospital. She assigned 3 sisters to the task: Mother Aloysia Nye, Sister Martha Toohey, and Sister Herman Murphy. The hospital was officially opened on October 15, 1888, at the Judge W.P. Street residence. The hospital remains to this day, having expanded into St. Joseph's Healthcare. As of 2025, the sisters are still actively involved in the work of the hospital through the St. Joseph's Healthcare Society. Hear from some patients and visitors celebrating the work of the sisters in the hospital over the years. 1942. Reverend and dear Mother, as time goes on, we find ourselves ever more and more deeply indebted to you and to the sisters of the hospital for the wonderful care and kindness lavished upon those amongst us who are chosen to bear the cross of sickness. You not only alleviate their sufferings and hasten their recovery, but are a source of joy and edification to them, and each and all who have come under your kind administrations are grateful beyond words. 1974. Hospitals are good, but can be very cold and depressing, but not yours. At St. Joseph's, I found the atmosphere of the whole system warm, with the staff having genuine concern and a willingness to help. Peterborough, celebrating the diversity of the sisters' ministries. The Sisters of St. Joseph of Peterborough have traveled across Canada and abroad to assist the dear neighbour, including the earth itself, through their efforts to support education, healthcare, and the environment. This includes opening a maternity hospital in Brazil, working with First Nations communities across Canada, assisting refugees, supporting those affected by HIV/AIDS in Zambia, and attaining Leadership in Energy and Environmental Design Gold certification for their new residents. Pembroke, celebrating the sisters' efforts in Peru. In 1964, the Sisters of St. Joseph of Pembroke traveled to Peru, where they provided access to education and healthcare. Their efforts were primarily in Chincha Alta, where they established San Martin Medical Clinic and San Jose School. The Peru mission formally closed in 2005, but the sisters continue to provide support. In Canada, celebrating the amalgamation, perseverance, and continuation of the sisters' mission. The Hamilton, London, Peterborough, and Pembroke congregations amalgamated together in 2012. Since then, the sisters have continued to respond to the needs they see.